I would say let's get started because today we have quite a packed and yeah, thank you very much for everyone who has found the time to connect today for these Gavi quarterly webinar. Today we are going to talk about a topic that has been coming up quite often lately, and it's about trying to integrate as many data as possible within the HIS2. In particular, today we're talking about campaign data, so any kind of like supplementary immunization activity. So the idea is that, of course, you have like plenty of activities going out there and plenty of data that normally like remains either on paper or in scattered Excels. And how can we bring and design the system to have all the data in one place, so we can start triangulating data better, so we can start analyzing data better, and we can start making decisions with better information. So just like as an introduction, why is it important of integrating in DHIS2? I mean, I hope that for some this will be a pretty evident answer, but for those who are still a bit exploring the idea of an integrated routine health information system, main reasons why it should be at least convincing enough, it would be because an integrated system where you have like all the kind of data in one single repository where you can just like source all these information, is because you can have a comprehensive assessment. So in this case, for example, you can have like your routine EPI data that like monitors all your ongoing efforts of the routine programs. Of course, then you can start bringing in campaigns or surveys that give like a quick snapshots of one-off activities. But then, of course, this also gets triangulated also with other programs and other type of activities that provide also real-time data that can inform your decision making. Of course, this also has impact on planning and coordination, because, of course, if you start having more data that are better triangulated and better monitored, you can start having stronger and more informed collaborations with other stakeholders. As we know, other stakeholders also run similar activities in countries, and it's very important that all these results get pooled together so that you can actually have access to a unified data set where you can triangulate all this information and make sense of all this data as well. This has an impact, of course, on accountability, because once you have your comprehensive data that is all integrated in one place, it's more transparent, and it's easier also to track progress, but also to clean up data that maybe like have outliers or like don't make necessarily a lot of sense, and correct these numbers accordingly. And of course, all of these, when you have like cleaner data, when you have more transparent data, when you have better collaborations among stakeholders, you can also have like a better resource allocations. So you can start having like better coverage data. You can start therefore allocating vaccines, probably finding better pockets where of underserved populations, or in general like tracking population better in order to target your patients and in general the populations in need with better data. And of course, all of these can contribute to better interventions. They are more timely and real-time monitored, so you can actually have better overview for your coverage rates, so you can have better overview of your responses, and you can triangulate better your responses, as we know that in the end, immunization goes hand in hand also with your surveillance system. One little thing I forgot, of course. We have, like, as I said, quite a packed hour ahead of us. So please, if you have questions and such, of course, you can post them in the meeting chat. But as I'm alone today to present and such, so if you see that I'm not able to get to the questions, Alice has kindly put also the link to the community of practice, where also the announcement of this webinar was. So please post those questions there as well, because I will be following up on these questions there directly, or send me also an email at victoria@dhis2.org. So continuing on our general overview of why integrating all this information is important, we also need to know like what kind of information we are putting all together. Of course, we can bring in surveys, for example, or any kind of information of supplementary immunization activities. All this information together can have a role in updating EPI data, because of course, once you have also SIA, I mean, I'm gonna start abbreviating supplementary immunization activities with SIA, and this can create also a reliable blanket baseline that can also update current vaccination coverages. I can also help you reconcile any type of discrepancies between EPI data and the information that you just collected during your activities. It can also validate this data because, of course, once you have the discrepancies, once you might want to start investigating them, whether they are like these substantial discrepancies or just in general, like updating your baselines in order to analyze data properly and accordingly to the most up-to-date numbers of your coverage, for example. And of course, all of these together can trigger action because when you analyze your information alongside your routine data, so your EPI data, you can start identifying better pockets of, for example, zero-dose children. You can start check areas where low immunization coverage is present, but also you can start trying to triangulate better your information with your surveillance data, trying to make sense of data and information that might normally be seen as odd, but that maybe are actually just red flags of either data quality or of pockets that are undeserved. And of course, we'll also be talking about rapid convenience monitoring. Rapid convenience monitoring, I mean, are also type of activities that come hand in hand when you do SIAs or in general, any kind of like activity regarding immunization. And of course, these can, on top of the type of roles that we saw for SIAs and the surveys, these can also provide information of behavioral drivers of vaccination, because during RCMs, it's also very common to collect data, for example, on why certain children were not being vaccinated during these campaigns, which then in turn can impact our, for example, health promotion policies or in general, the way that we target certain type of populations. RCM data also provide information on supervision for SIAs activities, because this can happen either hand in hand or at the same time as your immunization data, campaign data, or right afterwards. But in general, like it gives you an extra layer of check, let's say, in order to control whether the information that you've gathered is informative enough, whether any kind of, for example, once you start doing your activities or your survey for the coverage, whether all the clusters were addressed, and so in general, it can provide a very useful supervision tool. And then, of course, as we were saying earlier, this goes hand in hand with any other type of information that you can have on immunization. It can highlight any kind of discrepancies. It can highlight any kind of pockets. It can, in general, provide an extra layer of information where you can analyze your data, either for routine or one-shot activities in the realm of immunization, but in general, within your routine health information system, because we know that in the end, programs, yes, they sometimes tend to go in a silo where they check their own data, but we know that, the key point of integrating all this information together is, of course, to be able to check, for example, your measles numbers together with your measles coverage, nutrition together with malaria. So is the idea of really having an integrated platform where you can start checking all the cofactors that can have an impact in your programs. Of course, we, like saying all of these together, it has an added value for our early warning system. It can have an added value for, of course, our monitoring activities in our immunization activities. And of course, it can tailor better our interventions, because once we start triangulating, once we start validating this data, we can better tailor this intervention, because we are more confident about our data, and we know that chances are we are better prepared, we can have a better micro planning, and we are able to actually serve these pockets in a better way because we know where we are targeting, how we are targeting. And therefore, it allows us to identify precisely what kind of activities and where these activities have to take place. So the idea is, of course, as we're saying up till now, is the idea is to put everything in one platform. So you can have your routine data, your EPI data, but you can bring in also your SIA data, you can bring in your RCM data, you can bring your population, your coverage data. Of course, we have like the component of logistics and cold chain and supply, of course. And of course, you can have other programs, as we said. We can have nutrition, we can have maternal and child health, or for example, any kind of immunization activities that goes hand in hand with like key group of populations. So like, for example, older populations, or for example, healthcare workers. And of course, we also know that a lot of other specific immunization programs, like for example, COVID or flu programs, have also the tendency of also like being a little bit more isolated. So there is really the possibility to bring everything together in one platform, so the entire program together with other programs can benefit from this sharing of data. And of course, it happens very often that countries we collaborate with, they see that other organizations run, of course, other type of immunization activities, so be it campaigns, be it coverage surveys and such. And they say that therefore it's difficult to integrate this information later on. But of course, with different kind of approaches, we can also bring in information that are coming from third parties. There's just like a handful of organizations that we see in the field, and you can still bring this information in your data repository, because nonetheless you receive reports and you receive at least the outputs of these activities, and you can still integrate and put these numbers in your system to have up-to-date kind of information. So what are we going to see today in the demo? It's going to be about fictional data, of course, and it's going to be about some fictional campaigns that can happen. But in general, we're going to, like, for example, give an example of a vaccination campaign that MR that was carried out in March 2023. Of course, it has like some bits and bobs that have been taken as source of truth from different type of campaigns that we have collaborated with. But it's just to give you an idea and just to try to concretize a little bit something that for some people might seem still a little bit too abstract to be seen in your routine HMIS. Then, of course, we're also going to like have a quick overview on an example of a rapid convenience monitoring that was carried out as this MR campaign was being rolled out. And we're going to see how this type of data can be collected and what kind of outputs you can obtain from these activities. And of course, these RCM in particular is going to be, it's an event. You will see it, I will show you. And the metadata has been taken from, as you see here, I mean, it will also be available, the slides, but it's like from the reference manual for vaccination coverage cluster surveys. So the flow, the logic, and the metadata is very much taken from these guidelines, and it contains like very simple basic info. And once you have the information of the household or the children, you can start finding out whether this child was there during the campaign itself, and whether if it was present during the campaign, whether this child will receive the vaccine. Or, for example, you can start triangulating better information with the routine EPI, because you can start also checking whether this child had received another vaccine during the routine activities. So there is quite a range of information that can be obtained also from RCMs. And of course, there are also different examples of vaccination coverage surveys that can happen post-campaign, but also, as we said before, as third-party coverage. And of course, integrating coverage poses a challenge sometimes, because of course, that means that like you are using the latest type of information when you're analyzing your data, but these can have the added value of resulting in a comprehensive and updated data repository. This particular data set was designed to maintain its like the most simplistic design ever. So either there are like, here we have two examples. So either it has two basic data elements. So you can have like how many children, or depending on your target population, were eligible, and how many vaccinated children. So you can have your coverage. Or you can just like directly enter the coverage already calculated, because, for example, your information is coming either from other type of tools, be it from, I don't know, DK, Kobo, or simple as an Excel, or reports from a third parties, for example, and therefore you might have your already calculated coverages. That doesn't prevent you from integrating this type of information to the system. So there are different approaches depending on what kind of resources, but also what kind of information you have access to. Of course, the periodicity can be tailored to match the different specific needs of the context. You can set it as daily. For example, if you are like if you are handling the coverage survey directly from the system, so you're wanting to update as much as possible following the different organization unit and the different days where the actual survey is managed. Or, for example, it can be simply, as we said, for example, you have your example 2, and you have only like the outputs from these surveys, and you might want to simply like take into consideration the month where the survey happened, or the year when this survey happened. So it's very much dependent on the type of information and how you want to manage this information. Of course, what's very important is the fact that countries need to find a way to make sense of all this information being put in one repository. So, for example, here, as you will see also in the system, once where I enter the system directly, you will see that, for example, I called this campaign MR2303 because I knew that it was an MR campaign that happened in 2023 and in March. But this is just one example of like 100 different types and ways to, for example, name these campaigns, but also to recognize the type of campaigns that you are managing. Of course, when we are talking about this kind of information, we cannot not think about the organization unit, because actually the organization unit is one of the first things that has to be considered when managing any kind of program, really. So, for example, if you're managing directly the campaign or the survey, probably you want to have a separate instance, because this way you might want to, if you're entering data directly during the activities, you might want to target directly either a community level, or in general, like being able to access directly the lowest level where your activities are taking place. While, for example, you need at a certain point, when you are integrating this information with your routine health information system, you need to associate this information with the hierarchy that you have in the system. Therefore, for example, at a certain point, you might want to aggregate this data at different levels. So you will see this example where I have my campaign at district level, simply because, for example, I don't know, the actual rollout of the campaign was handled on Excel, and I simply have an aggregation of this data. Or you can really go down to the bottom level where this data was taken and collected. So it's all important considerations that, of course, are described also in the documentation that we have previously published on the use, the implementation, and the design of vaccination campaigns. But these are a little bit more like, we wanted also to give you the opportunity to see how all of these together may look in the system directly. And of course, there are also a bunch of dashboards that I want to like show you around. And so just to give you an idea of some of the information that you can actually extrapolate from all these type of different data. So actually going directly, here is our routine HMIS. This is coming from our demo environment, which is like a fictional, I mean, you see that it's Laos, of course. We have an agreement with the MOH, has allowed us to use the country for demo purposes, but here you see that it's like a dummy data, and in general, it's just to give a better representation of like of an environment that is really showing the country, not like a made-up country. So you normally would have in your routine HMIS or your different type of of programs that you can start like triangulating with all the different dashboard and such. So here, for example, we are having our data for EPI, and it's the routine dashboard that you've seen many times. You have all the type of information on coverage, dropout, and AFI, and also, of course, LMIS. So you have also your temperature alarm, your cold chain, functional refrigerators. So the usual routine type of information that you might obtain from your HMIS. And then, of course, you might have also your, sorry, I have plenty of tabs already open because I didn't want everything to fail, because that happens 100% of the time when you're demoing. And then, of course, you might have also your information that you're extrapolating from your campaigns. So, for example, we were talking earlier that, for example, your campaign can have different targets, can have different type of antigens, and can be aggregated at different levels. At this level here, in this example, we are aggregating at district site, and we are having, for example, the campaigns target at annual level. Okay. In this particular case, there were two different age groups that, for example, were targeted. And these particular age groups and population that was our target population, well, was also disaggregated by the distance to the facility, for example. So depending on where these people were residing with respect to the facility, also different type of approaches for this delivery was put in place. So, for example, this would have been a fixed place, this was an advanced place, and this would have been probably a mobile clinic. This is just like an example that we have taken from an actual campaign, but just to give you an idea of like how many different possibilities you can have out there. Of course, this is not prescriptive. Again, it's just to give you an idea of what you can do and how this data can be collected. At the same level, you can aggregate your information. And of course, at this time, I put it at daily level because the idea was, for example, for this fictional campaign was to have it at real-time aggregation of all the different sites that were being vaccinated under specific districts. The type of information is very basic and follows, of course, the suggestions of like most of the organization are there in the guidelines. Just collect what is truly informative and basic so you can actually make actions out of that. So how many doses were given, if there were any AFI. And we have also taken it from our COVID metadata, as we also say in our documentation. Try to recycle as much as possible what you have out there. You don't really need to reinvent the wheel. You have probably done already a bunch of campaigns and you know what kind of information you're normally collecting. So we have also started adding, like, for example, the staff, because it's always handy to know what kind of like volume of staff you're supposed to have during certain activities and how many staff actually were present and what not, because as we said earlier, different tools can also be useful for supervision during certain activities. So these are very basic information that you can obtain during the campaign itself. And once you are actually monitoring your campaign, very slowly, of course, then you can put everything in a dashboard. Of course, you can start having separate dashboard for different campaigns, or you can put the same campaigns for the same antigens all together. It's very much up to you how you want to manage this type of information. But nonetheless, you will have updated information on certain areas and for certain antigens, for example. So you have here, for example, your target population, how many doses were administered, your coverage. Of course, you can have legends that will allow you to see the different, like with different colors, the kind of coverage you might have. Here, of course, I push the data to like the limits just to give you a preview of what type of information you can extrapolate. So you see, for example, that already like the coverage for one age group was higher than the other. So you might maybe want to check what is going on, if there were like different type of communications, if there is any kind of pattern within the community that drives these, or simply was like a casualty and there is nothing you can do right now. Of course, the usual coverage and the map that is always very handy. Checking out your age, You might want to check also the coverage by age groups to see if there is any kind of like discrepancy. And here, of course, you have your target coverage and the different cumulative values, timeline values for the different age groups, for example. And you can also extrapolate, as we said, like very basic information, but the type of AFI that you had throughout the campaign. We're talking about these days of the campaign that in this particular case, it was just this fictional campaign that was carried out in the north of the country. And you can see, for example, where these AFI happened and where the most serious one were happening. And of course, you can also have informational staff, as we're seeing earlier, where you can start like here, I put also like a little note to better interpret the kind of information. So you will see, for example, if there is also any kind of pattern with your staff of not showing up. So for example, here you see that there is like a negative value. And if you calculate the kind of like discrepancy by site, you might see that, for example, in these two sites, like people were not showing up as much as they were supposed to. And here it was even worse. So like just to see if there is any kind of pattern as well. And of course, you can start comparing things around. Here I did it on purpose, like there are like chances are there are like data mistakes and such. These are like realities that we can see in all the environments that we check. But of course, this is fundamental to start checking. I
think we have the one that we are.
I'm glad that people are laughing. But everyone, please. Okay, I'm muting you all. Sorry, it's not polite, but otherwise we will miss time. So so you can start calculating this information as well. Then you might have, like as we said, you start having your vaccination campaign data in the system. You start plotting and seeing maybe like for your real-time information, what kind of information you can extrapolate for these. So you can start checking how your situation is going, where your coverage is higher, where your coverage is lower, if there's any kind of patterns. And then we said that, like, for example, here you can also run an RCM, so a rapid convenience monitoring. And this has been taken from the manual of cluster surveys, as I said. In this particular configuration, we're talking about an event, so a one-off in DHIS terms. So you have your report date, your coordinates, so you can actually like go, if you have like better mapping abilities and you have like, for example, your areas well mapped out, even by household, you can really start finding the households that you are meant to be targeting directly through the maps. Of course, you have like, since it's a cluster survey as well, you have your strata and you have your cluster number. You can start using it to enter the interviewer number and the supervisor number, because of course you have your teams, you have your supervisors, and you can also check who carried out what kind of interviews. You have your household ID. You can have like different number for the child. In this case was from the form, but it can be also like, I don't know, national unique IDs and stuff, depending on what type of information are available in country. And then, for example, you start checking whether the child was present during the campaign. And you can start checking, for example, what was the primary source of information about the campaign. And so there are different options that were like the standard option that were available in the source where of the manual. So let's say, I don't know, it was school, for example, and whether the child received the MR vaccine during the recent campaign. So let's pretend it was, he said, the parent or the guardian said yes. If there is any perception of a reaction during that was followed the vaccination, so yes or no, depending on whatever the answer. Let's pretend that it's a yes. And if the child received a vaccination card after or during the campaign, so let's pretend it was a yes. And we can also ask if before the campaign the child had already received a vaccine. So yes, it could be that they have a card and therefore the dates were available, or it might not be available, or they don't know. So depending on that, you also can extrapolate this information. Or for example, we said that the child did not receive the vaccination, although they were present during the campaign themselves. So you can start asking why the child was, although it was present, did not receive the vaccination. Or, for example, as simple as the child was not present during the campaign at all for a variety of reasons. But, for example, you can still check whether the child had received during the routine activities any other amount. So it's very simple, very straightforward. Of course, this is just one example of many different type of forms that I've seen out there for RCMs, but this is like probably one of the most basic that delivers all the key information that might be needed for the purpose of cross-checking the data collection, the outputs, and also for supervision purposes, for example, and to extrapolate also extra information like behavioral drivers, any kind of like extra information that we might extrapolate to better target communities if they are rejecting and the coverage, for example, we see that it's very low. So we can extrapolate all this kind of information. And then there is also, we were talking about vaccination coverage surveys. In this case, for example, I put it at a lower level. Why? Because the data per se maybe was collecting through another tool or in an Excel or directly on paper. But for example, I wanted to still nonetheless write the day where this collection happened, and I wanted to really have like where, like the lowest side in my hierarchy, where this data collection happened. In this case, I cannot do, I don't have necessarily have to report all the information of the vaccine of the coverage survey. But let's say I have only the outputs that are available, and therefore I add them directly into my system. Or, for example, that we were saying earlier, there are other third-party surveys that we have, like, I don't know, reports or any kind of outputs, and therefore we don't have the baseline and we cannot enter all the type of information that we might want to enter. But still, nonetheless, let's say if we have like a report or we have already calculated the outputs of our coverage survey, we can still enter our numbers, and let's pretend that in our survey it was a 96% for these and a 90% for the other age group. So you can still report the percentages directly in the system to update the coverage in the area. And this can, and we saw also in the other examples, it might also be that you have access to a larger number of data. So you might also want, instead of entering directly the coverage, you can enter the target population and how many people, for example, with a vaccine you found. So there are different ways of collecting this type of information, and you can enter either or depending on your resources. Overall, you can still have this information put together in one place. So here again, extreme data, trying to make like to underline the absurdity of like some data that we see out there, but that otherwise probably would have been a little bit more difficult to highlight and find out if the data would have been like scattered in different repositories, or if one was in HMIS, the other one was in an Excel, and the other one was still on paper. So you can see really like appreciate at glance one summary for all the different activities. So here, for example, we have reported during the SIA groups. Here we have like the coverage vaccination survey with the different age groups. So you see that already there are like some differences here and there. And of course, we have also the coverage that was reported by the RCM. Again, done on purpose, completely different coverage data. Could be for a variety of reasons, but just to highlight how easy this would be then to appreciate the difference in data and to start investigating if there is any kind of discrepancy. You can also compare this data, for example, here would be your routine data directly from EPI, because we are in an integrated environment. And next to it, we can start putting, for example, your vaccination coverage survey, your actual coverage coming from the SIA, and the one coming from the RCM. And you see, like, you can start comparing what kind of discrepancies, if any. Again, this has been put in an absurd and like complete different way on purpose, because it can be very useful to appreciate the differences. But you can also plot them out in maps, and you can also start putting, for example, the different clusters that you have highlighted, because you have, like, of course, your summary average coverage in your area, but then you can start seeing that within certain area, you might have also clusters that have a better coverage than others, for example. So you might want to, for example, investigate why there are certain clusters that have low coverage than other. And maybe you have to do like any kind of like mop-up activity to make sure that your coverage is increased in those areas, for example. And here, for example, you can also compare the AFI that were obtained from the data set of the actual vaccination campaign, and the ones that we were seeing from earlier from the RCM of perceived reactions from vaccination. So, for example, this is the one that we were seeing earlier from the SIA dashboard, and this is like from what we saw from the reported ones from the RCM. You can see that there are differences, of course, but then it might also be informative to better understand what kind of like type of adverse event the community is understanding, if there are like major discrepancies, whether there is like a certain kind of uncertainty, and whether, for example, there is like a big fear of adverse reaction, so they are over-reported even though nothing happened. So in general, it can be indicative and can be very useful, especially for communication purposes, and to organize also informative campaigns in order to target as much people as possible. And then, of course, we know that RCM information can also provide us with behavioral drivers. So, for example, here we have like, we can summarize the reasons for people not being vaccinated. Of course, these on purpose, I put all the possible type of information that you can extrapolate. But then here in the map, you can also dig in and you can start clicking and see the different type of clusters and communities that you might have, whether there are any kind of pattern distributed in the areas, just to inform also the next rounds, or in general, like your health promotion activities, for example. So you can start, for example, digging in, and you might know that like in this area, most of the people, for example, didn't know about the campaign. So what happened during communication? These, of course, are like very simplistic and easy to manage summaries. But you see that, like, for example, when you start having more information and you start digging in also with other programs and such, it can be very useful triangulating all this information. And for example, also like what kind of source information they are using in order to be aware of these campaigns. So in this case, again, I put all the possible information, but then you might start like digging in. This is like one type of map that we're having available within the system, that it's like part of like the core range of maps that we have. You can start digging in and you can start skimming down. For example, if there is any kind of pattern of information that certain communities are using more than others. So to make sure that, for example, for the next round or for any kind of mop-up information, the activities are actually being communicated accordingly to what is being used the most. For example, if in this area, most people are using, for example, the purple is church, for example, and no one is reporting that they heard it from radios and such, you might want to invest more into like getting linkages with religious communities and such. But I mean, these are like very obvious things for people who work in the field, but this kind of information can also be present in your routine information system. And of course, these are also like other examples. For example, here on the left is the number of children who were present during the actual campaign, but they were not reached by the activity. So you can start seeing where the highest volume was of children that were not reached. And here you can have also the information on the number of children who were already vaccinated by the routine vaccination activities, so by the EPI, but independently from whether they were vaccinated or not from the SIA. So you can start having also this kind of information. Or for example, here you can start comparing your coverage as extrapolated from, of course, your routine EPI data, but also as reported by the RCM during the activity. So for example, this is the coverage from EPI, and this is the coverage from the RCM activity. Whether there is any kind of discrepancy, whether you see that there are like problems in reporting reporting, whether it's reliable data and whatnot. And maybe like a lot of people were saying yes, but you were not able to see the cards. So you can't even certify 100% whether these data are reliable or not. But yet, again, this is like, of course, I've done it on purpose to like miss some areas. I have like some discrepancy and things like that. But it's just to like make you understand how like a different layer and a different point of view of your routine data can also try to like trigger some kind of like data cleaning, some kind of like question making, let's say, because if I start seeing that there are like substantial differences between certain kind of reports, I might want to investigate further whether there is one side or the other of both sides, if there is any kind of issue with reporting, or whether like these kind of questions are being interpreted and any kind of like reported answers directly during the surveys and stuff. Of course, this information needs to be run accordingly to protocols and such. This is just the very like last step, so the outputs from all the activities. Of course, this information have no validity whatsoever if the surveys and the RCM per se are not following a substantial and a well done protocol for implementation. And same goes with the campaign itself. But you can start appreciating at least that all this information put together can give you an extra layer of information that you can start comparing within the EPI and across the different activities as well. So actually, I was faster than, and I don't know if I mean, I don't see any question in the chat itself, but if there is any questions that you might have in, actually, maybe that would be a good time to even just share any kind of like even experiences that you had, if you had any experiences to bring in this type of information directly in your routine HMIS, if you faced any difficulty, or whether you'd be willing, for example, to start considering entering more of this type of information in your HMIS for extra type of data and more updated data of your areas and your coverage, for example. I don't know if like anyone would like to comment or give us an insight. Can you clarify? There is a question. Can you clarify this from the platform? It's not to achieve and when it does not. What are we going to do? So no vaccination as well. Of course, like for vaccination stock as well. I mean, I don't have much data here because I didn't have time to enter mock data, but of course you can triangulate the mock data as well. Like you have it here as well in our stock in the demo. You have your stock data and you can start following your temperature alarms where there is like in this case would have been just here across the north because that's where our campaign was happening, for example. You can start checking any kind of like a cold chain issue that you were having, if there was any kind of wastage rate, and any kind of like stock status, if there is any kind of like a stock outs and such. So also for micro planning purposes, it's very important to consider your routine data and plan accordingly, depending on your comparison, also a different source of data. Could you put aside Kobo and Power BI and use DHIS2 totally? I mean, it can be done. It can be done. There are, of course, like a bunch of considerations of implementations to keep in mind. And these are, I think, very well outlined in the documentation that we have put out a while ago. It's in our documentation page. And you find under the immunization program, there is a vaccination campaign. And there are 3 chapters, one for use, one for implementation, and one for design, where we give you more consideration on how to use DHIS in order to design, implement vaccination campaign and other type of vaccination activities directly in the system. Of course, for example, as I said before, if you are running directly the campaign, you might have like different organization units in the company that you have to like use in the campaign that might not be available in the routine information system. So probably you might want to have a separate instance that then afterwards that can be used for real-time monitoring of the campaign itself, and then you can aggregate the level so that it matches also your routine information system, so that you can actually start using this data accordingly together with other programs. But indeed, if need be, DHIS could be used from actual micro-planning and monitoring of the current status of the immunization activities in country or in a specific region, in a specific district, depending on the level of analysis, and can be used to monitor in real time. It can be used also to evaluate or at least report the outputs, which is something that we've seen that happens very often, that especially when it comes to more updated coverages, therefore like post surveys and such, this information normally gets lost. And therefore, if there is any kind of updated number that can actually favor the activities and give also more information, it's very important to make sure that this information reaches the right place so you can actually start using this information. Where are some of them? I mean, we have like plenty. We have plenty of implementation that has happened like throughout many countries. We have like plenty of implementation that happened already for vaccination campaigns in West Africa, for example, Uganda, Mozambique. And of course, these are considerations. Right now we are talking about specifically campaign, but many of these considerations can also be taken into consideration with other type of mass activities. So for example, any kind of like distribution of supplements or any kind of medicines, of course, but can also be for campaigns for distribution of, for example, mosquito nets, or indoor spraying and things like that. So these are also considerations that can be useful in general for planning, putting into place and monitoring and evaluating the impact of these more shorter intervention, one-shot intervention, but that nonetheless can actually help you having more up-to-date type of information in the system. These indicators can be calculated and displayed by side, of course, depending on the type of population that you are using. Of course, that is very much up to the type of campaign that you are, for example, implementing. Could be a national campaign, could be a very targeted campaign for a specific subgroup of key population and such. So maybe you have to extrapolate these numbers from another source. Normally in your routine HMIS system, you also have your population data. We know the difficulties and the problems with population data. I'm not going to start into this one. We have actually quite a lot of resources and other webinars that have covered this topic and deal with population data denominators and advanced mapping. So if you want, you can also go and check in our immunization YouTube channel about these type of information. And but indeed, you can calculate them depending on what kind of baseline and the type of population baseline that might be relevant for your activity per se. And as of course, as Anna is mentioning, that these can have, of course, quite an impact on logistics. But like, for example, just to give you an example, for example, Uganda has also has been using DHIS also for their education information system, and therefore for certain type of campaigns they were using as a site, a vaccination site, as schools, and therefore their target was also based on schools and attendance, and it was based on the attendance sheets that was coming from their education information system. So they already had their baseline data for their denominators, and with these baseline data, they already were able to put in place a microplan that considered staff, that considered logistics and all the relevant information in order to target the right population at the right time. So there are plenty of information that you can triangulate and plenty of information that you can extrapolate and use as your denominator and baseline depending on your activities. How can I access the data collected from a specific country by DHIS? This is actually a common question that happens very often, but UIO and any all the other HISPs, we do not have access to country data. DHIS, we provided DHIS as an open platform. I mean, it's usable, downloadable, and configurable by the different countries and the different type of implementations. But once it's implemented in country, it's fully owned and managed by the country itself. So I have no data. No one has data from countries, actually, unless you are actually part of the HMIS or MOH or Ministry of Education. So there is no way to extrapolate this data. This data belongs to the country, and it's only managed by the country. If there is any kind of data coming out, it's because the country has any kind of deal and an agreement with either a university for research or for a paper and things like that. But we do not have access to data. And I want to reinforce that because it's a common question that comes out. I don't know if I missed any kind of yeah, this is like actually a nice one. If there are any dashboards in DHIS2 that are interactive and could be shared to public or only to DHIS2 users. Of course, I mean, DHIS2 users depend very much on the type of setup that you have in countries. So different users have different rights. So you can either see your dashboards. There are some users that have admin rights, and you can edit the data sets, have more administrative roles, and be able to like configure and do more like an in-detail job directly in the system. And of course, you also have like data entry rights, for example, where you're only allowed to enter data but not edit the type of information and what you are collecting, for example. So there is no ability to change the metadata. We have examples of, for example, open public portals that are using data collected through DHIS. That's an example actually in Tanzania. There is like, even if you Google it, there is like an open portal coming from the MOH that uses fully the dashboard from DHIS, and all the information that you see are actually coming from there. There are also other type of more customizable dashboards that countries can also implement. Uganda often uses, for example, customizable dashboard that might be a little bit more interactive. These are like truly like the core functionalities that you're seeing now. And it's very much depending on the type of implementation. Different countries have had different solutions. And actually public access is something that gets requested very often, either because of different uses of the data or because different people have access to so many different type of platforms that it can be a bit tiring to find every time the user, the password and such, but also for transparency and actually accountability. So as, for example, the Tanzanian MOH has put these data that are available to the public, and the public can go and check these numbers. And these are numbers that are fully coming from the national HMIS, for example. So there are actually examples out there. And I would suggest like checking out, for example, in our community of practice or in, for example, the impact stories, specifically for this use case in Tanzania. It's actually coming from our latest webinar that we had. So I would suggest checking it out because it has had quite an impact in the reliability and actually the accountability of data in Tanzania, because users start flagging if there is any kind of like possible mistakes, if there is any kind of gaps that they are seeing, and like it really triggers the population to be engaged and up to date with the numbers that are collected at national level. Do we have access to the demo site? Yes, of course. If you Google the DHIS2 demo and you check it also in our various page and documentation, you have access. Just mind that what you see here, it's HMIS dev, so this is still in our development instance. It's simply because we haven't put it into the public demo quite yet, but it's a matter, honestly, of days. So yes, you will have access to all these dashboards. There are already plenty of dashboards, of course, in the demo, but the specific ones of the SIA, it's a matter of days, really. I mean, we only have like a couple of minutes left. Just to remind you that if you have any kind of question, doubts that are coming, like with retrospective thought about what you heard today. Again, insight, experiences and such that could be relevant to share also with the wider community. At the beginning of the chat, we have also posted the community of practice link. Please go ahead and post your questions there. I will definitely follow up directly in the community of practice with extra kind of information and also relevant links that could be useful also for you to follow up. So for example, the demo I can put there. I can put like the links to the documentation that we had already put together for the implementation, the use and the design of DHIS for SIAs. But yeah, the main purpose of this session today was just to show you what is coming up in the demo itself, just to make sure that potential implementers and end users can really understand a little bit more like pragmatically what they can achieve and what can be obtained directly from HMISs. And yeah, because sometimes it can be a little bit abstract to just think, but then I only enter the coverages, how does it work? You've seen it, it can totally be done. And you can then obtain all this information, like this information here that it was like from the coverage vaccination survey. It was entered just with the coverages coming from outputs, for example, and with the idea that you can recycle what you already have. You can keep it very simple and try to really take advantage of your integrated environment to truly make use of these numbers, because we know that we have like a lot of data out there. We know that there is like not enough data use, and yeah, these dashboards can really help you to have a glance extrapolation of data that can really help you informing your programs. So with this, I thank you very much for being with us today. All the resources will be available, including a recording, the slides, and relevant links for you to further investigate the use case itself. So thank you very, very much again, and I hope this session was useful for you. And again, please feel free to reach out either directly in the community of practice or sending me directly an email. I'm happy to follow up with anyone who could be interested in the use case or who has like any kind of like a relevant use case that want to share to give also a little bit more sight of implementations that are already happening. Thank you very much again, and well, I hope you're having a wonderful remaining of the day, morning, depending on where you are, or evening. Thank you, and until next time, bye.